It's so painful to always feel fragile, tired, throw up, see your hair fall, and on top of that have a destroyed immune system. The list of chemotherapy side effects just goes on and on and on. And during all this pain, you can't stop thinking of one question. Is chemotherapy worth all this trouble? Today I will tell you about what chemotherapy is, why it can cause strong side effects and make you feel so terrible, and most importantly, does it always work? Chemotherapy was actually inspired from a toxic gas used during the First World War called mustard gas. The soldiers who were exposed to the gas felt like their lungs were on fire and their eyes were burning. So the doctors at the time wanted to find a cure for these soldiers. In that process, they noticed immediately that the toxic gas can get inside the body down to the bone marrow and affect the production of blood cells. At that time, it was also known that cancer cells actually have similar behavior to the cells in the bone marrow. They can grow and replicate rapidly all the time, which inspired the doctors to create chemical compounds similar to the toxic mustard gas and inject it in the cancer patient's body. So chemotherapy is in its essence a toxic compound to the cells, no matter if they are normal cells or cancer cells. And thanks to the advancement in medicine, today we have more than 100 types of chemo medications, and they can be delivered in pills or injections depending on the patient case. So now you know a bit about chemo, let's move on to why some patients feel terrible during chemotherapy. The biggest problem with chemo is that it actually spreads all over the body once you take it and visits all your cells and not only the cancer cells. Chemo is supposed to damage all the cells, most of all the rapidly growing and dividing cells. Cells like your hair cells, blood cells, gastrointestinal cells, and your skin. These cells are dividing all the time, which means that first, their DNA is less protected in the cell, and second, that they are craving for a lot of resources from the body. So they will be taking in more chemo than other cells, and the chemo will damage their DNA and make them die faster than other cells. When these cells die, that's when you get the terrible side effects. At this point, you might be wondering, then how come that the patients don't die of this toxic chemo immediately? Well, the answer is when you give chemo in small doses, the normal cells can still manage to fix the damage in their DNA and repair themselves. On the other hand, some cancer cells are really bad at repairing their DNA, thankfully. So chemo in this case is more toxic to cancer cells than to our normal cells, which of course can sometimes lead to curing the patient completely from cancer, or at least reduce the size of the tumor. But here comes the hard question. Does chemotherapy always succeed in killing the cancer? The scientific research shows that chemotherapy doesn't always lead to an improved survival in certain cancers. But for some cancers, it might be the best treatment option. Let's start with esophageal cancer as an example. Based on this study conducted in 1998, the survival rate was the same with chemo plus surgery versus only with surgery as treatment option. So the authors concluded that chemo didn't really help in this case. But to be fair, this article was published in 1998. So let's check some more recent research. Well, it seems like the patient have better outcomes when you combine chemo plus radiotherapy and then followed by radiosurgery instead of relying on only chemo or only surgery. This combination seems to be successful since the chemo and radiation force the tumor to shrink and make it easier and safer to surgically remove it, which in its turn will improve the survival rate of these patients. Let's move on to other cancer types. Based on the research, the chance to survive testicle cancer is up to 95% today thanks to chemotherapy. In fact, it seems like chemo is the favored treatment method for this cancer type. I also found that the same principle applies to some leukemia cancer types, mainly the acute myeloid leukemia, which is a cancer of the bone marrow and blood cells, so it makes a lot of sense to have chemo as the main treatment option. Chemotherapy in this case seems to be working very well for the young patients, but it can vary a lot based on the age and other factors. Alright, let's take another complicated cancer type, like the head and neck cancer. In this case, it's very rare to treat the patient with only one kind of treatment, but rather we use a combination of them and aim to make the tumors more sensitive and respond better to the treatment. The most common combination you can find is chemotherapy plus radiation therapy as a standard care for these patients with locally advanced squamous cell carcinoma. Based on the published studies, using chemotherapy can significantly improve the survival rate of these patients. So as you can see here, it all depends on the type of cancer and what other treatments the patient is giving in combination with chemotherapy. And this is no secret, it's all based on respected research available to everyone online to read about it. My idea behind this video was to inform you about chemotherapy and let you think about the topic, and should not be treated as a medical advice. After all, your doctor is the person invested in your case and knows what suits you best. So thank you so much for watching, and I'll see you in the next one.